Department of Homeopathy Philosophy, Dr. Padiyar Memorial Homeopathy Medical College, Chotanagara, Kerala, India. And the topic is a talk on chronic disease. This is the main aspect of treatment in the homeopathic system of medicine. This is the backbone, I must say, because we know that the situation before the discovery of chronic disease, as mentioned by Hahnemann, the treatment, their beginning was promising, continuation less favorable, and outcome hopeless. So not to make the outcome is a successful one, we must have a thorough knowledge on the chronic disease. And of course, Dr. Prakash is a capable person who is to explain all these things on behalf of IFPH and Dr. Prakash. You can have the platform for next 40 minutes. It's over to you. Please proceed. Yes, right. Good.
Thank you, Doctor. Good evening to all. Today, we are going to discuss about a brief description regarding the chronic disease, which all of us know. Homeopathy has got its own imprint in the treatment of diseases, especially in chronic diseases. The acute disease, all of us know, it's very rather easier or to prescribe or to get a prescription. In acute disease, it needs only 2 or 3 points like exciting cause and the most troublesome symptom of the patient. So it is very easier. Even the physician, we don't need any time or any questionnaires also, because it is spontaneously expressed by the patient because of its recent origin due to its violence. They will express all the condition in order. And it's very easier to prescribe in a case of acute conditions. But homeopathy gets a pillar role in the management of the chronic diseases. And today, I want to emphasize upon how we should approach, as per our philosophy, as per our organ of medicine and other homeopathic philosophies, how we can conquer the chronic diseases. So, the scenario is very changed from Hahnemann's time. Now, we are forced to, or we are facing a good number of chronic disease, and whenever we get a chronic disease, we should categorize that disease whether it is a true natural or a pseudo-chronic or drug disease. I think I don't want to go to explain about what is true natural, what is pseudo-chronic, or likewise. Anyhow, a good number of cases nowadays we force to manage drug diseases. That is, drug abused. As a result of this modern life, the style, the methodology of patients' diet, habit, etc., all are changed. All the majority of the people suffer some stress factors likewise. And they develop this as pseudo-chronic disease, which are resemblance to chronic disease, but there is no miasm in the background. We know our master has got a keen observation power and he knows the evolution of disease. Whenever we are facing a chronic disease, after going through the evolution, after going through the history of the patient, we will come to a position to know whether this patient is suffering from a true natural or a pseudo-chronic or a drug disease. So if the case is true natural, see, our principles and theories, which we are followed in our PG degree courses, are moreover strict upon these true natural chronic diseases. But they were large in number during Hahnemannian time. Hahnemann himself expressed 7 out of 8 chronic diseases, 8 diseases are psoric diseases. So here, psoric phase, nowadays we are facing what the major problem is that we will get a condition, a chronic disease, bit later. Sometimes after a course of allopathic treatment or any other system like Ayurveda, likewise. So the patient reaches us bit later. And it will take its own time, first of all, to clear his constitution. So we are facing a good number of problems when a new patient comes. His history may be mixed with the drug symptoms and the patient symptom. And we have to keenly observe which are the symptoms which are pertaining to the drug and which are the symptoms of that particular patient. That is why nowadays we have forced to prescribe that partially similar medicines. All of us know what is partially similar. In majority of cases, 70%, nearly about 70-75% of cases, we will not get the direct medicine in the first visit itself. We need to take a evolution of that condition, and man, as he said, a chronic disease is a continuation of the previous one. That's what he mentioned in the third aphorism, the knowledge of physician. If the physician clearly perceives what is to be cured in disease, that is to say, in each and every individual case of disease. That means the conditions, the stages, the different cases, different type of disease, he goes from his birth onwards. Even before the birth, suppose for an example, I'll say during the gestational period, mother is taking thyroxine as a precaution medicine. Not medicine, it's a supplementary hormone, all of us know. Nowadays, it is very fashionable to the gynecologist or other allopathy physician to prescribe this thyroxine as a preventive rather than iron or calcium tablets. So when the mother taking this thyroxine, it will spontaneously goes to the womb and it will reach to the fetus also. Now we are facing a good number of children, pediatric cases when we observe, they are very hyperactive, they are obese, they have got a constipation, likewise. We will suspect, or rather simply by taking that just that physical and his mental constitution, we are prescribing any medicines. Some medicines which we come into the similia, as per similia. But here, the cause is overindulgence of this thyroxine, which is not needed for that particular child, and he shows the symptoms of that thyroxine. So there we need to antidote that condition. We will think this child is that what we call hyperactive child, and may prescribe belladonna or Nasmoscata or Tarantula, likewise. But it's not the story really. When we are taking the history of the mother itself, whether she's, we should start the case from there, and we have to develop the evolution of that particular patient's condition. So our role is to prescribe the patient as per the status morbid, the present status. That is what is known as, we can't prescribe a medicine, we can't prescribe a similar medicine in all aspects in the first visit itself. Sometimes it will be possible if the patient gives, see clearly as mental symptoms are rich, or a case of fibromyalgia. Whenever we are taking a case, what we are looking is how this disease evolution of that particular disease in that particular individual. See there, the predisposing weakness of their defense mechanism, that is vital force, it can be affected fundamentally. That is, the defect starts fundamentally by hereditary influences, strong infectious disease which he suffers in the earlier phase, previous treatment and vaccinations, wrong way of living. So these four factors are very important. That will give us a clue regarding the type of disease he's suffering. Suppose he's having that pseudo-chronic disease where miasm has got no role, their homeopathic principles, that is the law of similarity, law of minimum dose, and that single medicine, etc., that has got only a secondary role. Primary role is to modify to give sufficient advice to modify his condition, to modify his life status. That's what Hanuman says in the fourth aphorism. He is likewise a preserver of health if he knows the things that derange health and cause disease and how to remove them from persons. This can be simply said as theory, but when we are practically facing our patient, majority of our patients will obey in the first few weeks or first 2 to 3 weeks. Then they will automatically go to that particular condition of likewise. So it's very important to give proper advice and sequels or sequences. If the patient follows such lifestyle, what is going to happen to him should be clearly explained to the patient, and we have to give a strong impact. For that, we can depend upon laboratory investigations. Sometimes some patients need only merely a simple advice. Some wants to give more and more importance to this advice. Likewise, some sort of expressing them whether your family has got any cancer history or cardiac disease or stroke. Likewise, so such questions should be framed in those patients who are, we think they will not obey our principles. So this wise, the case is constructed, and we have to give the advices regarding their proper. So suppose if a patient is having his dietetic errors, suppose we think our medicine is anti-crude or pulsarilla, whatever it may be. After giving these instructions, we can give pulsarilla or anti-crude again along with that principles which he has to follow in his lifestyle or mode of living. So these factors where a proper constitutional medicine is not required at the first stage, and even after a period of time, spontaneously, suppose the patient is having these mangoes and that jackfruit in this season in Kerala, if the patient assumes a good number of mangoes and jackfruits, definitely his blood sugar level will increase. And giving that clear idea why his sugar is increased, and if we advise regarding his diet and proper, if he cuts short those things, his sugar level will come down. And there only we have to look whether that condition, that diabetes, leads to some sequels, likewise diabetic retinopathy, diabetic nephropathy or neuropathy likewise. And if so, it comes to a pathological state. So there, the SORA, we know the miasms. I don't go to the explanation of these miasms, but we should remember these views of miasmatic theory are the most important contribution given by our master to the suffering humanity. He developed or he categorized the patients into 3 groups as per their pathology. If there is only a functional disturbance without any pathological damage, he categorized those cases as SORA. This is a very simple explanation. The theory is very long and wide, and it needs few weeks time to explain the miasmatic theory. All of us know. So if there is only functional disturbance, we have to select a soric medicine. And when the pathology starts, physiologically, SORA. When the physiology disturbed, pathology starts. And when the pathology starts, it may be of 2 types. It may be in the form of a proliferation, or it may be in the form of a destruction. Proliferation means anything which is excess. Destruction means damage. So excess is due to psychosis, and destruction is due to syphilitic miasm. So the theory of similia, we should follow here also. When we are treating our patient, we have to look out his background miasm. All these 3 miasms are there inside our body. They're in a position of latency. They're sleeping. And due to some external violence or external causes, so many factors, physical, chemical, mechanical, diver. So there are so many exciting causes which will arouse these miasms. If SORA is aroused, he will show the symptoms of SORIC picture. Psychosis of psychosis. So we generally, in our practice, we can see in cases of pediatric cases or children's cases, we are commonly using the medicines like chamomilla, cinna, sulfur, senna. Likewise, this colocin, etc. Those medicines' background is predominantly soric. Why? That's why the people generally think that homeopathy is suitable especially for a child. It's a children's treatment. It's therapy for children only. Because there is no function, no structural damages. Whenever the child got a simple catarrh or simple fever or simple abdominal pain, immediately the mother or the bystanders will take the child to the physician. So he will get sufficient time, or he will get a very easier selection, and the soric medicine will act simply very quickly. And if we are going to the age in between 30 to 50 or 60 likewise, we can see our prescription changes unknowingly. Majority of us prescribes pulsatilla, natrum muriaticum, lachesis, lycopodium. Likewise, the majority of chronic prescriptions comes in that way. If we are looking to what we can see, they are predominantly psychotic. And again, after the span, the 60 above, when the patient goes to his senile age, see, we are using what? Beretacar, lycopodium, Oramet, fluoric acid. So they are syphilitic in nature. So the generally, SORA, psychosis, syphilis is a chain like. Knowingly or unknowingly, we are prescribing anti-miasmatic medicine, definitely. But if we have got a clear idea regarding this miasmatic background, it's very easier to prescribe in a given case. The third one, that the drug disease, in drug disease, there seems to be incurable. We can only manage them. We can give some relief and manage the cases, because in drug disease, the vital force will sacrifice any one or two vital organs, which are very crucial, which are very important for, in order to get a permanent cure. The vital organs like brain, heart, lungs, kidney, and liver should be promptly managed. If the patient abusively taking these drugs, say steroids or any other chronic drugs, if that patient is taking such ways, there one or two organs will damage. Normally we can see this liver or kidney maybe get damaged, and in such cases we can't expect a permanent cure. That's what the problem in drug disease. There we can only manage. Suppose 3 patients comes and one says he's having diabetes, and if he correct his lifestyle, if he take reduced sugar, then his sugar level go down normal. It's a pseudo-chronic. And if some patients, we have to prescribe a constitutional medicine and then they got relief, that is soric nature. And even after prescribing a medicine, if the sugar level doesn't go down, we have to go for a palliation. That is, we have to go for a management. This third variety is known as the drug diseases. And there, this hereditary influence, that is, diseases passed through generations to generation. Strong infectious disease, we know. This period of COVID, a majority of people suffer from bad effects of vaccination. A good number of people suffer from the sequels of COVID. That's not the common scenario which we are seeing day to day, day by day. Post-COVID lung fibrosis will be there, and exertion dyspnea, or some patients develop renal damage, cardiac conditions. Though they are very apparently healthy prior to these conditions, even they don't know. They are now suffering because all these are suffering due to the after effect of a COVID vaccination. Even the malignancy cases which are previously treated properly and they disappear. I remember a case of CA breast. She has removed it in 2008 and underwent all therapy, that conservative therapy during that time, and periodical checkup was there with no any other sort of metastasis or other complications. But from 2022 onwards, she developed a lump in her breast and it was very painful. And she underwent that her early oncologist, and they diagnosed as it is a case of cancer, which is, I think, I explained her, this is because you have suffered from a COVID attack. She said she's having not COVID attack. And now it is present in the left breast. Right was removed earlier. Simply I prescribed Tuja 204 doses weekly once, and say within 2 months, that tumor become disappear. I prescribed Tuja because I have no other picture to get, or need not to take a detailed picture, because bad effects of vaccination is the key background of that particular case. It reappear after the COVID attack. So there, we know the bad effects of vaccination can be covered with majorly with the 5 drugs: Tuja, Antimonium tartaricum, Silesia, Miserium, and Crotalus surdus. Let's see, out of these 5 medicines, Silesia is the only one medicine which is predominantly belongs to soric group. Tuja and Antimonium tartaricum, both are psychotic, and Miserium and that fluoric acid comes under syphilitic group. So if we know regarding the basic symptoms of miasms, if the patient gives a picture of a syphilitic picture, damage, so see that may be a case of fibrous lung with abscess. There we have to select a medicine from the syphilitic group. So there are so many cut shorts and so many ways to prescribe in a case of chronic disease. All the chronic diseases are never need the same pattern. We have to develop this management of chronic disease as per Hahnemanian directions given in his textbook as well as in our philosophies. We have to find a new path. Then we will get an ample, protocol, and we have to follow that only. Majority of my students ask, sir, how we can know these miasms, or what is the need of these miasms to know? Miasmatic medicine will clear the past, it will remove the present, and it will prevent the future also. So then only we will get a permanent cure. As in our first aphorism itself, Hahnemann says his mission is to restore the sick to health, to cure. So first of all, we have to bring that patient in a healthy state, then only to cure. You should never prescribe directly in cases which are damaged pathologically by abuse of drugs or any delay in the or progress because of their progression of their pathology. There we need to arouse them into a state of apparently healthy. Then only we have to prescribe a constitutional medicine. That is what that comma denotes. And here, previous treatment and vaccinations, wrong way of living, all this leads to this origin of chronic diseases. In case of hereditary influences, suppose the families have got a good number of upper level diseases, upper level chronic disease. When we are going to a synthesis repertory, we can see the medicine, only one medicine, Buforana. So if the family is enriched with the chronic disease, her parents, brothers, siblings likewise suffers from cancer, epilepsy, or this sort of Alzheimer's, Parkinsonism, diabetes, whatever it may be. So these conditions, when we get that patient, first of all, we need to prescribe a medicine, what we say as an intercurrent remedy. We have to clear that history before, and is very helpful in chronic disease. And there are a good number of medicines just to start the treatment. Likewise, all of us know, Hahnemann advises alumina is one of the most important medicines to start a treatment of a chronic disease. And again, Hahnemann himself, he says, you should never start the treatment of a case of chronic disease with lycopodium, unless clearly indicated. Why? Alumina is predominantly a soric medicine, and it is a chronic of bryonia. And bryonia has got this key symptom is bry means dry, and that dryness spreads from both physical and mental levels. And when that case becomes chronic, it denotes more to stick on more to alumina. So alumina has got a good number of physiological symptoms of soric miasma, whatever the condition she is suffering. So those medicines that got action predominantly upon skin is majorly soric, not at all, but it's a majorly soric one. And if there is a pathology in the form of a growth, in the form of a tumor, or likewise, otherwise anything which is increased, say hyperlipidemia, high sugar, hypertension, all this we are considering as psychotic. That's why in hypertension cases, we will get this natrium likewise. They're psychotic. And if it is due to some cardiac damage, we are blessed with the Oromet, it's a syphilitic one. And if it is simply due to an emotional excitement, we are prescribing, for example, aconite, that is a soric one. So in all medicines, there is a background of this miasm. And I want to emphasize, we should know before prescribing from which miasm this particular patient is suffering, in the present stage, because all these three miasms are present. But which one is predominant? The patient will show the picture of that particular miasm. And again, another class is there that combination of sora and syphilis. That is tubercular miasm. And in this tubercular miasm, what happens? The syphilitic patient shows the symptoms of sora also. Soric symptoms are also predominant. The king medicine for this sorosyphilitic medicine is tubercular miasm is arsenic album. Arsenic album is, that is why we say the key symptoms of the essence of arsenic album is an infection leads to inflammation, inflammation leads to suppuration, suppuration leads to ulceration, and ulceration leads to putrefaction in a rapid time, in a rapid speed. So this rapidity, that's why in corona stage, CCH, our Central Council has selected, I think so, this because corona is very rapid. Acute sore throat followed by very extensive pathology during the following days within a short span of period. Generally, in a case of pneumonia, it needs 2 to 3 to 4 weeks after a bronchitis. But in COVID pneumonia, the patient may goes to that stage within that first week itself, say by 4th day or 3rd day, likewise. He will die of this COVID pneumonia, and his pathology will extensively get worse and he goes to die. So that similarity is there with arsenic album. Arsenic album has also got a very speedy pathological proceedings, pathological development. Its speed is very high, intensified, very short and very high. That infection leads to inflammation, leads to suppuration, followed by ulceration and putrefaction. So arsenic album is said to be the king of this tubercular miasms. And then we know the Tuja for psychosis and this Mercurius for syphilis also. In I don't remember the book. Then there's the author says, when sulfur fails, we have to prescribe Mercurius. When sulfur fails, we have to prescribe Mercurius, because unknowingly, without our notice, the pathology may got so extensive. So Mercurius is said to be the last word in true natural chronic diseases. Mercurius or its derivatives like syphilitic medicines. So what I had to say is, when we are prescribing for a chronic disease which is a true natural case, which definitely need the demand of a constitutional medicine, a similar medicine, 3 points we should never forget when we are constructing our totality. That is the basic miasmatic background of the patient, his thermal reaction. Thermal reaction, what is the importance of thermal reaction? Thermal reaction shows, or it gives us a clue regarding the pathology of that patient. Pathological development of that patient, we can get a idea without undergoing any laboratory investigations. We will get a clear idea regarding that pathological condition. See, sora is generally soric. Psychosis is generally hot. And syphilis is generally an ambithermal medicine, ambithermal background. What is the difference between this sora and syphilitic chilliness? Sora has got a superfluous chilliness, where if the case is advanced pathologically, this syphilitic miasms has got both these hot and cold stage. When the patient goes on, is though hot, when his pathology becomes very advanced in some stages, then he becomes severely chilly. That's the peculiarity of this syphilitic miasm. Sora generally always chilly, but there are exceptions. See, the king of sora, which is sulfur, is very hot medicine. So there are some exceptions, but we should know that the miasmatic background along with this thermal reaction to know the pathology, and definitely we should know the side affinity too, whether his complaints are specifically brought on left side or right side or from left to right. Sometimes in some chronic disease we will face cases Say, doctor, I have got this tonsillitis since last 5 to 7 years or 10 years. Likewise, now I have got a severe pain on this tonsils. When we are examining, we may see the right side is congested and heavy, congested and ulcerated along with the crypts also. Then we should never forget that we should ask that special question: in which side you develop first? Sometimes it may be left side, and there the symptoms turns. Complaints begins in the left and goes to the right. These are some common simple errors which we are facing, which we are unknowingly doing in our clinical practice. We will strike that this is a right side medicine and right hot psychotic. Suppose his picture gives us a background regarding these 3 points. Patient is psychotic, patient is hot, and patient is having right side problem. We will magically prescribe lycopodium likewise, which is a right side hot and a psychotic medicine. But if the complaint stands on the left side, entirely the picture changes. Their lackage is the medicine. Left hot and psychotic one background. So this makes us a shortcut to our prescriptions. And what we have, how we can do, how we can manage these drug diseases. All of us know the most important thing is to understand the pathophysiological stage, the miasmatic background of a case, and after assessing his stage of this disease, if the organs are severely damaged, we must go to some physiological doses. In homeopathy, there is only 3 types of doses which we are prescribing. Either it may be a physiological, or it may be a subphysiological, or that subphysiological is known as this therapeutic dose. And the third one is pathogenetic dose. This pathogenetic dose is meant for drug proving only. But we can see, unless in some, unfortunately, in some acute cases, suppose if we prescribe Belladonna 6x for the temperature of that particular child, we can't assess the exact numbers or dose likewise, because as per our philosophy, we have to prescribe the second dose after observing the first one. So generally, this occurs, and suppose we say you have to take this every 2 hours till the temperature downs and his generals. Such as if the child asks some food or some water, or his feces passes or urine passes, then you have to stop this medicine. These are the advice which we are giving to that patient. But unfortunately, mothers will give this medicine frequently because to avoid this absence from classrooms, etc. So what happens? They will report in the second time that the doctor have given him that medicine, and after 2 to 3 doses, his temperature comes down. I have to repeat it to get a speedy recovery. But what happened is, afternoon session, he will develop severe temperature. He was very hot, red, likewise, and even febrile fits may develop. That is because the belladonna is acting as there as a pathogenetic dose. We want to stop that medicine whenever the patient's generals become improves. Maybe temperature may be there, or his condition may be there, but if the child passes a stool, or he passes some good number of amount of urine, or he demands some water or food, these generals are that clues for us whether our medicine is acting or not. Then practically how we'll deal it? We have to face good number of people. We can't go to behind them and advise to stop them when the generals improve. So we are generally giving an idea regarding when to stop this medicine, and then you have to start the second one in the form of a placebo. Then you should give first every half hourly for 2 times, then every 1 hour for 2 times, then every 2 hours for 10. So likewise, if we are giving, that is the practical way which we can manage this therapeutic dose. When it overseeds, it becomes pathogenetic dose. And This so after getting a clear picture regarding going through the whole history from the birth onwards in each and every individual case of the disease, the physician has to perceive. Perceive means go into depth, to look into what? To look into the history of the patient, from where, from his pathology starts, or from where his that normal vital force is forced to get this fight with these inimical forces. First of all, in first conditions, vital force itself will overcome because due to good vitality. But when it fails to overcome, when it becomes weak, and then it throws symptoms of the enemy he is facing. And the nature of the symptoms. From understanding that symptoms, we will get which enemy attacks him. Basically, it is a psoric enemy, psychotic enemy, syphilitic enemy. And otherwise, all the symptoms of that particular condition, we will get in a chronological order, and we have to give importance to the evolution. Suppose a case comes us with see, for example, hemorrhoids, where his rectum is filled with these varicose veins, hemorrhoids. And if we are going to his history, generally what we are doing, we are prescribing, majority of us prescribing sulfur or Naxvamica likewise in the first visit. If we are going to the history of that patient, he is having, when inquiring his history, he is having a fatty liver, and his liver size is 18 centimeter. And this fatty liver, if we are asking again, he is in the habit of taking this thyroxine for a thyroid increased TSH level, thyroid case. And since very early, since 10 years, he is taking the thyroxine. And we know this fatty liver is a sequel of this thyroxine therapy. And as a result of thyroxine, this liver becomes enlarged. It goes 18 centimeter, 19 centimeter likewise. Normally, we need 12 to 13 or 14 centimeters. And this added weight, what happened? It will push the intestines, and there is only a single opening in the lower abdomen, that is rectum. And all these veins goes towards that hole, and he develops a hemorrhoids. So his treatment consists of to manage that liver. In order to manage that liver, we had to look into the thyroid. In order to treat that thyroid, the prior history should be taken, the family history should be added. So this is a very lengthy process. This the chronic development of chronic disease is a very sequel one, where we have to begin from the very start itself. The last week I met a headache, a chronic headache of 35 years duration. The patient is having 46 years. She underwent all therapies. The physician says that's the case of migraine, and they are giving this migraine tablets with the antacids and some sort of sedatives likewise. The medicines for sleep itself. He underwent Ayurveda. All there are that likewise Ayurvedic conventional traditional Ayurvedic methods are followed. Even this, she don't get relief. And they came, and after taking the case, I came to know at the age of 11 years, a coconut fall in her head. She herself forget that. I asked prior, what events, what the sequence. I mean, accidentally she remembered and said, I have only history of a coconut fall under my head at when I am studying at 5th or 6th standard likewise. So there onwards, she's having mild pain, which she remember now only. That's why Hanuman says, then the physician must ask some precious questions. Some precious questions. Likewise, this type of incidents, even the patient may forget. And I simply prescribe her conium maculatum. Conium maculatum, within a very short span of 3, 4, 5 days, she's very, very better, and she slept well after prolonged years without this headache. So that's the beauty of homeopathy. So that's the beauty of case taking also. That's why Hanuman said, a well-taken case means half cured. So the first prescription is rather very easier if the case taking is properly done. And how we have to follow the case, that's the most majority practical problem which we are facing. Suppose if the patient comes and says, doctor, I have got some relief. generally our tendency is to prescribe to give a second prescription by raising the potency. We look, yes, I have given platinum 30. So now she needs platinum 200. And then during the second platinum 1. Likewise, prescription is very boresome. We have to look into the changes that brings by platina. And suppose the present stage is showing another picture to another drug, or whether her condition is generally stable. If the patient is improving, we should never repeat the medicine. Only go for that placebo therapy, the second best remedy. And if it needs some deviations in the previous state, some symptoms remain, and some new symptoms appear, then a new totality should be constructed. That's what in 171, I think 171 aphorism, and one says, in non-venereal psoriatic chronic disease, you may need several antipsorics in succession. Each successive one should be in consonance with the group of symptoms remaining thereafter. So it's not a simple way. Definitely, if you are getting likewise that the cause is get very easier to prescribe. Etiology, without fire, there will be no smoke likewise. So if we are getting a clear, definite cause, whatever it may be, maybe a psychological cause, a nervous cause, or a physical cause, a trauma, accidents, some other sort of acids or alkalis. So the management of chronic disease, after observing only the action on the first, there we are blessed with some observations given by Master Dr. Kent. And in Kent's observation, I'm not going through all these 12 observations. The most important observation which we are facing in our daily practice, generally we can see the fifth observation, that is, amelioration comes first and aggravation follows. Patient will say, doctor, after taking that medicine, I got a relief for a period of 1 week. Then my condition again gets worse. Unfortunately, if the physician is not in accustomed with this or philosophy, organal of medicine, applied homeopathy, applied methods, he'll force to prescribe. I have given Naxomica 30. Now, after 1 week, the patient gets worse. Since that 1 week, he got good relief. So the action of 30 is over. He decides himself. And will prescribe 200 or a hypertensive 1 likewise. What happens? Only the case is worst. We should never expect an amelioration immediately after taking a case. It's very dangerous. If the patient, after taking our medicine, says, yes, now I have got very good relief to my discomfort in the chest, we can see within a span of 120 minutes, he goes to the Almighty. So this aggravation, this is what we say, that homeopathy aggravation, it unfortunately our classes are not giving attention or not giving the importance of this base, that backstone, the organon. These, our neo-homeopaths especially, they will fill in a good number of confusions. Even they will hate homeopathy because the problem is there. They are not managing, or that they are not approaching the cases properly as per the directions given by our masters. There is, apart from this physiological cases, pathological cases can also be managed by homeopathy very beautifully. See, aphorism 6.3, I think. Every agent has got its, when attacking a body, there is a primary action and secondary action. Homeopathy uses the secondary action. Secondary action is of two types: secondary counteraction, secondary curative action. So the agent, that is the weapon we are applying in the primary action, should be similar to that of the conditions there. And he advised the antipathy also. Even Hanuman himself advised the need for antipathy emergencies like drowning, electrical shock, likewise. Those are the common conditions in Hanumanian time. And nowadays the picture is changed. And suppose if the patient is suffering from dyspnea, it can be compared to a case of drowning also. Then there you have to give palliative medicines. Palliative medicines means organ remedies which has prescribed in a physiological doses. When we are selecting these organ remedies too, we should look into for that similia, principle of similia. Suppose if majority of us prescribes aspidosperma, in cases of asthma to get sharp relief immediately. But there are so many other medicines also. Aspidosperma, Seneca, Grindalia, Lobelia, Aurelia, Eucalyptus, Balsam. Likewise, the good number of medicines. And each has got its own peculiar symptom. In case of Aspidosperma, when we are examining the chest, we will not get the trails. There is no pathology advancing in chest. The chest is apparently clear. And we are prescribing Seneca. Seneca should be prescribed in case of chest rattles with mucus. There is a massive production of mucus. There the Seneca comes. And in bladder, apart from this dyspnea, short cough predominates. This short cough predominates in bladder. In case of Aurelia, there is sneezing and cough. There is wheezing and cough, but sneezing predominates. So there are some minute points which will differentiate these medicines. That's the similarity of that condition and that medicine which is selected in a physiological dose.
Yes, sir.
And
Excuse me, sir. How much time you needed?
Sir?
Yes. How much time you needed?
Yeah. Sir, 2 minutes. 2 minutes.
Okay.
I got short. So, a case can be constructed by the presenting complaint, past history, family history, personal history, physical and mental generals, and thermal reaction plus miasm. This is the made out formula for a chronic disease. And if we look into that, our prescription methods, knowingly or unknowingly, all of us prescribes medicines for the patient only in 3 bases. Sometimes it may be a method of applied materia medica. After hearing the whole case, we, from our memory, we are collecting a medicine, selecting a medicine, and applying it. This is what simply say applied materia medica. There, the physician needs a very good hand of knowledge in materia medica. And another type of prescription is prescription based upon therapeutic prescriptions. That is what we are normally doing in acute diseases as per the diagnosis of the case. If it is a case of typhoid, we are prescribing Bryonia, Baptisia, acid force likewise. Or in a case of intermittent fever, Syngona, Natramur, or that is Sidron likewise. So there, the prescription is based upon the nomenclature of that disease, that is the diagnosis. And third one, if the case is enriched with the symptoms, we are not able to select a medicine, then we are going to that classical methods, that is by selecting the medicine based upon repetitization. So these are the 3 methods of therapeutics which we are prescribing earlier. And in potency selection also, we generally know the medicines comes from vegetable sources and chemical sources. And vegetable sources are generally should be given in bit high potency. Suppose if we are prescribing Bryonia 200, the same case if it is alumina, it should be prescribed in 30 potency. That is, kingdom decides the potency. Apart from, along with that susceptibility, seat, nature, intensity of the disease, likewise we know stage, duration, and selection of potency depend upon seat of disease, the previous treatment which the patient undergoes. All these are common incidents. So, by considering the picture, by deciding whether the chronic disease which we are going to face is a true natural pseudochronic or drug disease, our prescription methods is entirely changed. And if it is a true natural, we have to look for that miasm by tracing of the whole history and prescribe a medicine which is most similar to that particular condition. And if it is pseudochronic, the advice comes first. And secondary role to homeopathy medicine. And in drug disease, we have to go for physiological doses to manage that condition. That's what I had to simply few words regarding this chronic disease. I thank Dr. IFPH, which is very wide and very enormous and this enthusiastic gives the new homeopaths on our homeopathy world, homeopathy fraternity, including our patients and publics, and all the categories are highly pleased with this IFPH forum and this very good service work what we are doing. I again thank all of the office bearers of this IFPH, and this was my talk. Thank you all.
The next presentation, it once again reiterates the importance of more deliberations and discussions as well as reflections on the fundamental principles of homeopathic philosophy. You mentioned about the beginning, about the pseudo-chronic disease or drug disease. I think it was mentioned by Hahnemann as this accessory miasm. Am I right?
Yes, sir. Accessory miasm.
Yes, the condition created by these vaccines, as mentioned by Hahnemann, as the accessory miasms. And fortunately, you mentioned about a couple of medicines that are very important, including the Silesia. Most important thing, as a result of this massive COVID vaccine drive. If this time for discussion, those who would like to participate, please raise your hand because it's an important session. And those who are presenting this topic, they will get some sort of satisfaction from your queries. That's the most important thing. Then you mentioned about this antidoting, this thyroid treatment, the medications. That's more important. We must well aware what are the medicines they are applying, what are the methodology they are following each and every time. Just like as mentioned, just like the ladies changing their bonnets.
Yes, sir. Apart from homeopathy
fashion.
we are forced to know about allopathic pharmacology also.
Yes, that's the most important thing. So we must study that also. The two topics that are different, the degree course of MBBS as BHMS is one is the pharmacology and another is anesthesia. I think a study is needed more in this pharmacology also.
Yes.
Then you mentioned about this pseudo-chronic disease and the treatment, children treatment. Also very important. I think Hahnemann mentioned about the reason why these medicines in the children are more effective. Because two reasons are there. One is there is no much suppression. And the second one is they are innocent, they are not at all prejudiced.
Yes.
That's the most important thing.
Yes, sir.
Another one is mentioned about the drug disease.
Yeah.
Yes. Pardon?
Within a very short span of this time, we will not have, I know.
Yes.
We will not get
this must be read in each and every day as our respective Sridhar sir mentioned. You don't read other religious books, but you read this organ of medicine each and every day.
Yeah.
Very important thing. Then mention about this this drug disease and pathology, how it transforms from drug to pathology. Then regarding the application of this COVID preventive, I think arsenic balm is selected because it's the ability to produce symptoms in almost all persons. If you select a plant medicine, that will not produce such symptoms in that much intensity, that much rapidness is there. That is also one of the reason why this arsenic album successful, and unfortunately we lost our genius person. I'm not mentioning with use of sepia in case of because he might not have studied this well. That's the most important thing. You may remember him. I am not mentioning. He's not there.
Yes.
Then anti-miasmatic remedies, that's also very important. Then this dose, regarding different types of doses, that's also very important. Because homeopathy is a long system of medicine, is very much concerned about the dose.
Yes.
The infinitesimal dose. There is another, the allopathy school only based upon the weight of the patient.
Yes.
About that.
The prescription is based upon the body weight.
Yes. Then another point you mentioned about where to stop. That's the most important thing.
Yes.
You're studying the learning drive. What is more important is how to apply the brake. That is the most important thing. Here also you just wisely mentioned about that.
To shift the gear also.
Yes, that's the most important. Otherwise, it is very difficult. Then you mentioned another point is that when the general is improved, you must stop the medicine.
Yes.
That's the most important. Then I must mention another point is that the repetition, the potency, not in the ascending or often, as mentioned our master. When you give the 30th potency, the next time you can give 24th, then the 18th. That is because the character signals are not much prominent when the remedy is applied, not the medicine.
Yeah. That's entirely a new lesson for me.
Yes,
we can go down also.
Yes, it was mentioned in the
chronic. As per the susceptibility,
is there. Yes. Then you mentioned the application of mercury. Mercury, so many medicines mentioned by Hahnemann, including Naxomica. Give a small dose of Naxomica in between, a small dose of mercury in between. A lot of things has to be studied, the footnote itself.
Yes.
Yes.
So this
Dr. Dhanesh, is the backbone of this great session. Dr. Ganesh, please.
The only word I have to say is that really, Prakash, Doctor, has rocked the floor. It's such a beautiful presentation. Show the beauty of homeopathy in chronic diseases, and as everybody know that chronic diseases are the place where homeopathy can do wonders, and most of the uncurable, so-called uncurable diseases are cured with homeopathic medicines in different parts of the world by different doctors. But the thing is that most of them follow the same method, that is the Hahnemannian method. That really brings that kind of result. Of course, in pathologically advanced cases, there can be changes, and that also Hahnemann himself has changed medicine at different times. And one point I would like to add that Dr. Prakash Doctor has described about the inimicals, as well as what are the contraindicated drugs, and why that is more relevant in homeopathic practice. Nobody is bothering about all those things, just prescribing, and sometimes whether you are not getting. So also, what about the complementary, how it can be used? All these things were written beautifully by Dr. Hahnemann. Unfortunately, once a doctor become a doctor, when a person become a doctor, he just go on to the practice and never open the Bible of homeopathy, that is the organon of medicine. And definitely, if everybody read at least one page of the same, your prescription will become more sharper than what you are doing now. That's
Yes,
what.
Dr. Ganesh, time to wind up, please.
Yes, sir.
Extend a lot of thanks to our Honorable Prakash sir. Yes.
Yes, Rambaresh sir will do, sir. Sir
Okay,
has,
okay. Yes, one of the senior most person with a strong voice. Sir, please. Yes.
Congratulations, Ganesh ji and Manoj ji.
Thanks.
Or thank you, Dr. Prakash sir.
Yes, sir.
Excellent session.
Thank you,
Very
sir.
nice presentation and
Thank you.
deals chronic diseases.
Yes,
According to homeopathic science, main cause of disease, pseudo, sora, miasmatic. There are three types of disease, three
Yes.
types of miasmatic, role of miasmatic in homeopathy,
Yes.
organon of philosophy, sora, psychotic and syphilitic. Angle
Yes.
of treatment, first
Yes.
symptomological angle,
Yes.
second miasmatical angle, third
Yes.
pathological angle.
Yes.
Symptomological angle, acute disease, treat acute disease, the best role of the homeopathic science. And miasmatical angle,
Chronic disease.
according to miasmatic medicine, Puja, Merxol, Sora, king of soric remedy, sulfur, and
Yes, sir.
queen of soric remedy, Sorinam, king of antipsychotic remedy, Thuda, queen
Excuse
of
me, sir.
antipsychotic remedy, Medorinam, king of
Excuse me,
antisyphilitic
sir.
remedy, Merxol,
Yes,
and
sir.
Pilnam, queen of anti. Thank you, very, very thanks.
Thank you, sir. Thank you.
Prakash ji, very nice describe the chronic
Thank you.
disease. Thank you,
Thank you.
thank you.
Well, that was the end of today's English edition. Hope you that we'll be back again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam. Thank you.